You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, affordable health care for seniors. With us, we have an expert on the topic, and today we're talking about what some people are calling the best kept secret in affordable health care for seniors. With us, we have the Chief Medical Officer of JenCare. With us, we have Dr. Jonathan Flacker. Dr. Flacker, welcome to the program.
Thanks for having me.
All right, now for people that don't know JenCare, you're the Chief Medical Officer.
Yep.
What is your role at JenCare, and what is JenCare, and what is the typical patient?
Well, my role at JenCare is to be sure that all of the seniors that come to our center get the great VIP level of care that we expect to provide for everybody. JenCare is a senior medical center. We deliver primary care to seniors, and we've actually been around for quite a while. The whole organization has been around about 30, 35 years. We are designed to deliver really great primary care. We want to be America's leading primary care provider. In fact, we want to transform the care of seniors in the United States because we don't believe that what most seniors are getting is what they deserve. They deserve more. They've contributed a lot to this country.
Okay.
And a lot of people have fragmented care. They don't understand why they're on this medicine or that medicine. They don't understand why they're going to all these different specialists. The specialists don't talk to each other. They don't understand why the doctor...
So you handle everything right there?
Right there in the center.
Okay.
With a doctor who's going to look you in the eye, not looking at a computer screen the whole time. They don't understand why they don't get personalized attention. And we're all about delivering personalized VIP service, and really it's heartwarming.
You've kept the stats. You say that your doctors spend 5 times more with patients.
Oh, yes.
Five times more time with patients.
Oh, yes. Typically, in a year for a Medicare patient, you might spend 20 minutes on average face-to-face with your doctor in the whole course of a year. For us, it's more like 3 hours over the course of a year that you're there face-to-face with your doctor, because we like to see you frequently, and we like to continue to touch base about your conditions. If I tell you you have a really serious medical condition and we have to do something about it, and then I say, come back and see me in 3 or 4 months for another 5 minutes, how serious could that be?
Now, this model at JenCare, the doctors spend a lot of time with patients, like 45 minutes, up to 40 minutes on that initial intake, but they also give their cell phones to the patients. You give your cell phone?
I give my cell phone to all my patients, my cell phone number. I tell them I don't sleep with it under my pillow, and we do have an on-call service. But
all the doctors in all your centers
do
this?
Yes. When we look to hire a doctor, that's the kind of doctor we want. We want a doctor who wants to have that kind of relationship to their patient, with their patient. We want a doctor who can break down those barriers that have grown up in our healthcare system.
Okay.
So yes, patients will text me about they're feeling this way or that way, or my blood sugar's this morning, what should I do? And instead of it taking forever for that to route through some system, I can quickly text them back because I know who they are. At
the top of the show, we said this is possibly the best kept secret in medicine. Why do you say that?
Well, I think that people have grown to have certain expectations from their healthcare, from our usual system of what we call fee-for-service medicine. That's what we have here in the United States, and this is totally different. And when people are trying to figure out whether they want to do something totally different without experiencing it, it's sometimes hard to make that change. They're used to what's happening now, and on many levels, one of the barriers is people have grown to accept that that's maybe the best we can do. And so I'll accept that. I'll accept that my doctor's office doesn't really know who I am, or honestly doesn't look at me when they're busy on their computer, doesn't even look at me during an appointment. But you can do better. And as people experience it, that's who a lot of our referrals are from. Many of our referrals are friends of our own patients, family members of our own patients. The mother comes and then she tells her husband he needs to join, and then their sisters and brothers are joining, and it's actually really kind of heartwarming to see the referrals we get from our own patients, which is probably our biggest source of growth.
Now, your company's goal is to be, I guess, the America's leader in primary care.
We want to be
for seniors.
We want to be America's leading primary care provider. Not only do we want to be the leader in primary care, we want to transform the care for seniors in the United States. We don't want to be the leader in doing what's been done for the last 20 or 30 years that we don't think is working. We want to create a new, better way, and we are creating a new, better way of delivering care for seniors.
Included in your program, right, if they have Medicare, I mean, these are people that, a lot of the people that you see are below the poverty level. Is that right?
Oh, yes. We have people in public housing, people who have Medicaid. Income is not a barrier to joining our program as long as you have Medicare Advantage.
If you're over 55,
and over 55,
and you can sign up for an Advantage plan.
Then, yes.
And I know the cost of these plans. I mean, these are inexpensive plans, right?
Sure. And under Medicare Advantage, there's actually a lot of benefits that come with that for often a lower cost than what you might be doing otherwise.
Okay. Now, we're going to take a quick break. And when we come back, I want to know a little bit about what people can expect on day one when they take a tour of your center.
Great.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
My name is Frank. I've lived in Atlanta approximately 30 years. I've been going to JenCare about 3 years now. Now, I'm gonna tell you what I like about JenCare, what I really like about it. I like JenCare's approach. If there's a way to get the same result without medication, they'll do that. You know, traditionally, men don't like to go to doctors. And JenCare makes it easier for a man to go to the doctor. Dr. Papadesu, that's my doctor. And I'm crazy about it. I'm comfortable with her. I think it's a partnership. My weight's stable. My blood glucose levels, they're stable. Everything else is in good working order because of JenCare. I would say my experience with them has been pretty good because I keep coming back. I smile when I leave JenCare. What can I tell you, man? I mean, you know, I'm down with that.
If you're a senior, now is the time to select your doctors and benefit plans for 2019. JenCare Senior Medical Centers give you access to doctors who actually listen.
Oh, Dr. Jones and I are experiencing a great relationship because he listens.
Call today to select the kind of doctor and care you deserve.
Just because we've gotten older, it doesn't mean that we're not able to do.
JenCare loves seniors and accepts many Medicare Advantage plans.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, affordable health care for seniors. If you're on Medicare, you have to hear what Dr. Flacker has to say. Dr. Flacker, welcome back.
Thank you.
Now, when I look at the testimonials on your website, these patients are really bragging about you. What do they like most? Like, how is this so much different than their other Medicare providers or primary care that they're used to experiencing?
I think that patients like most that we're breaking down the barriers to them getting good care. One, if they can't get to our center and they live within 8 miles, sometimes more of some of our centers, then we'll go and get them. We don't charge them extra for that
So
transportation.
you'll pick them up and drop them off?
Pick them up.
Really?
We'll take them back home. Absolutely. They love that once they've been to our center for most of their medicines, they don't have to go somewhere else to go pick up their medicines.
Okay.
They leave with their medicines in hand.
So if this JenCare philosophy, the way you're practicing medicine for, affordable medicine for seniors, if it's so good, why isn't everybody doing it? Because logically it makes sense. You go to a place that will pick you up and drop you off if you live, close to the center. You see the doctor and spend 40 minutes. You'll see the patients once a month, if necessary. You encourage once a month to see them. Why do you think people aren't doing this?
Well, I think a couple of reasons. One is they may not know we're there. A lot of people have just kind of gotten used to the care that they're getting out there, and healthcare for seniors is often pretty much a mess. Really, truly, not coordinated. Nobody's paying attention to all the medicines that somebody's on. Nobody's trying to understand how what you're doing at this specialist is matching with that specialist. In many cases, you can't even get in to see your primary care doctor, so you're just going to the urgent care center every time something happens. But people have...
And that could be expensive.
Oh, it can be very expensive. Or you get sick and you call the ambulance and go to the emergency room, and even if there's, quote unquote, nothing wrong and they send you home, that's very expensive. But people have gotten used to that being the system. That's kind of the normal for them.
Now, where JenCare, where you get your reimbursement is keeping people healthy, keeping them out of the hospital. Is that right?
Yes. So when we say we're going to see you every month, more, we want to see you however often we need to see you. If it's every day, it's every day. If it's every week, it's every week. it's not because we were trying to generate a new bill every time we do that. We get paid the same.
Okay.
Our success is your success. When you're healthy, when you're out of the hospital, when you're having as many healthy days as possible, that's success for you. And it turns out that that's also success for us, even if you're looking at it just from a business point of view.
Now, you're pretty high tech over there, so everybody is given a life card.
Yes.
What is that?
That's awesome. So as part of your first day visit when you come in, they will take some information. They will take your picture. They will, we do a heart tracing, an EKG, and we put all of this on a card for you. It does a number of nice things. One is, if something does happen to you and you end up going to an emergency room and they do an EKG, one of these heart tracings, one of the problems is they don't know what the old one looks like, so it's hard to compare. You just take out your life card and show them this is what my last EKG looked like.
So it's like their medical records on a digital card.
No, there's some information there. There's not all your records, but there is a number of how to reach us. We've got somebody on call 24/7, and I've gotten called from the areas. The other thing is when you check in, you don't have to fill out paper every time. You just scan your card, and all your information comes up, and you're put into the system. All and the people in the back know you're there, so they know to come and get you and bring you back for your visit with your doctor. And so it saves a lot of that kind of paperwork filling out time for you.
Now, what about walk-ins? People that have, unexpected situation going on.
A lot of places you talk about whether they might accept walk-ins. We don't accept.
Like a same-day kind of a service.
Yeah, we don't accept walk-ins. We celebrate walk-ins. We want our patients to come when they need us.
Really? So you can just walk right in and be seen the same day?
Yeah, that's what we want. What's your alternative if you're not feeling well?
Okay.
Your alternative is to go to the emergency room? Your alternative is to go to an urgent care clinic? Or your alternative is to come see a doctor who actually knows what's going on with you? I mean, it's kind of an easy choice. And from our point of view, again, in trying to provide that VIP level of service, we welcome that. We encourage that.
Okay. Now, what about the healthy senior? Somebody that's feeling pretty good, they're in their 60s, 70s, 80s. What's their advantage getting involved?
Sure. Well, the advantage of a healthy senior is to keep you healthy. A lot of medical conditions don't become maybe readily apparent until they've gotten pretty advanced. 77-year-old guy who shows up at the hospital in heart failure, and his heart's only pumping about maybe half as strong as it should. And that's the first presentation. That was my father, who doesn't live near a JenCare center.
All right.
If that was a JenCare patient, we would have known about that because we would have already done heart testing ahead of time, even though he presumably was normal and wasn't showing any symptoms. We would have caught that and been able to treat that and prevent him from getting that sick that he ended up going to the hospital.
Because you see them once a month.
Because we see them once a month. We can keep tabs on what symptoms they have because we proactively assess people's heart function. Everybody comes in. You get a test, you get an echocardiogram, a test of your heart function, so that we can treat early signs of problems before they get so bad that you end up really feeling the effects of it.
Okay, good. Now, your centers at JenCare are also like a community center. You have activities, things like that.
Oh yeah, you can go in and sometimes we're playing music, and sometimes we got games going in the waiting room. We also have, on a more regular basis, we have Tai Chi. So we have exercise classes, and Tai Chi is one of the forms of exercise that's actually been proven to reduce falls in seniors. So particularly for people with mobility issues, but really anybody can come and participate in our Tai Chi classes. We have other exercise classes.
You have acupuncture, is that right? For certain centers?
Oh yeah, we have acupuncture. So under a lot of plans, you got to pay out of your pocket for acupuncture. That's included in our service. And acupuncture's been great for many, many people who have chronic pain. Acupuncture keeps them really active.
Look, my program has been on the air for more than 20 years, and there's a trend in medicine, and that is this concierge model. And it's for the wealthy. A wealthy person could pretty much own a doctor for $5,000 a year. They get to see the doctor whenever they want. Now, under Medicare, you guys are basically doing the same thing they're doing.
Sure. Why?
Except for they get to see you every day or every month or whatever you want. Is that true? Is that a fair comparison?
It is. Why should great care be only available to wealthy people? I mean, great care is great care. Our seniors who have worked hard their lives and contributed to this country, contributed to their communities, they don't deserve great care any less than anyone else. And so that population has been really ignored by the healthcare system. We are creating, we are evolving, we're always improving a way to give them VIP
And you take
care.
most of the medical insurances, is that correct?
Yes, to be part of JenCare, you have to have a Medicare Advantage program, and we work with the best of the Medicare Advantage providers in the country. In Atlanta, we work with Humana and WellCare and Cigna. They're our partners. We're always growing that list, but under a Medicare Advantage with one of those insurers, yep, you can be a JenCare member.
Now we have a clip of what some of your patients are saying, and also kind of a little bit of a view of the center itself. So let's take a quick break and go to that.
I'm Barbara, and I have been in Atlanta for 20 years. I have 7 grandchildren. Then I have 5 great-grand. I got a lot of good reasons to stay healthy, a lot of them. Before I came to JenCare, I was running all over Atlanta to go to different doctors. And with JenCare, I'm in one spot for everything.
Relationships are important. They are the basis for treatment. Barbara, she's amazing. She's a wonderful lady. It's a joy to take care of her because she does all of the great things that I ask her to do.
My doctor and I get along fantastic. He's like a son that takes care of his mama. They show me how to live a better life. They take the time out to hear what I gotta say. Besides the grace of God, they're the reason why I get up in the mornings.
JenCare Senior Medical Centers give you access to doctors who actually listen.
I'm just like going to one of my relatives' house. I can sit down and talk. I feel like family.
Call today to select the kind of doctor and care you deserve.
I am real excited about going to JenCare.
JenCare loves seniors and accepts many Medicare Advantage plans.
So those patients seem extremely happy. That's common.
That's an everyday experience at a JenCare center. Patients come in, they see our center, they see our service, they come to their first appointment, they get loved on by our staff, and they're happy, and we're excited about that. That's what drives us and motivates us every day.
And this is not the kind of thing I hear from a medical doctor that's a primary care provider. I mean, most of them are very frustrated. They don't like what they do.
And when we say that we're transforming care for seniors in the United States, it is transforming care of the seniors. It's for the seniors.
Okay.
And it's also for the doctors. Our doctors are happier. Our doctors are
Because
more
they can
engaged.
spend more time with
Because they
patients.
can be the kind of doctor they always thought they were going to be.
And when I say that primary care physicians tell me that they're frustrated, they're only frustrated because they don't have the luxury of time that you have.
It's the luxury of time, and it's the luxury of a organization that supports you in being able to manage all the things that are going on with your patients. The whole organization is designed around the primary care doctor and
Keeping
that
them
team and that
healthy,
connection. With
keeping them out of the hospital, all of those things.
all of those things. Healthy, happy, more healthy days.
So not a lot of centers like this around the country, right?
No,
Okay.
at this point we're in 7 states. We've got over 50 centers, and we're always growing.
Now, you know, here in California where we're taping this interview,
Yeah.
my father's 83. I said, after talking to you, I'm looking for something like this for him. I couldn't find it.
Yeah, and it's
But this is
it's
the new
unfortunate.
medicine. I mean, this is the new way seniors are going to be taken care of.
It is. It's really
Because Medicare is covering it.
Medicare is covering it, and you're getting a broader range of services and better services. This is like, we used to think about, what's innovation in medicine? Innovation in medicine is this cool new gizmo, this
Okay.
funky machine, this great, cool, cutting-edge laser-filled something or another. But actually, the most effective innovation in medicine is touch and respect and listening. And we're bringing that back to the patient encounter because we really feel like that's been lost over the years.
We're going to take another quick break. And when we come back, I want to know if somebody is not satisfied with their current health care and they're over 55, I want you to explain to me how somebody can make that change or get started or where they start or how they find out more. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
If you're a senior, now is the time to select your doctors and benefit plans for 2019. JenCare Senior Medical Centers give you access to doctors who actually listen.
I find JenCare doctors have probably, I don't know where they learned it, to look at the human touch.
Call today to select the kind of doctor and care you deserve.
That's why I feel good about JenCare.
JenCare loves seniors and accepts many Medicare Advantage plans.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, affordable health care for seniors, and specifically the special needs of low-income people that want great health care. With us, we have an expert on the topic. He is the Chief Medical Officer of JenCare. Welcome back to the program.
Thanks.
So if somebody's not happy with their current primary care physician, they have Medicare or Medicare Advantage program, how do they get started to make the change? What do they have to do?
Sure.
To be involved with what you're doing?
Well, the best way to do that would be to come and visit one of our centers. Give a call to one of our centers, come in for a visit, take a look around for yourself, kick the tires, talk to some of our present patients, and if after all that you decide you want to make a change, and I feel pretty confident you will, then we can walk you through that process. It's actually pretty easy. It only takes a couple of minutes.
Now, for people that are low income, maybe they don't even have a ride to get to the center, you'll pick them up at no charge. Is that correct? I mean, if they live within like 8 miles of the center, somebody will pick them up and even drop them off at home.
Oh, of course. We're so confident that this is going to be so different from what you've experienced before. When you see what we're doing, when you feel kind of the vibe of the center, when you talk to our present patients, we have no problem arranging for you to get there and get home from a tour of our center.
Now, for some of the seniors, and I've asked around, I have some older senior relatives, they said, dealing with Medicare, being on the phone is a real hassle. If somebody comes in on one of these tours, wants to find out more, and they're confused by Medicare or Medicare Advantage, I know you're not an insurance, you don't cover that, but you'll point them in the right direction on how to get started with a Medicare Advantage program, things like that?
Oh, yes. And it's actually a pretty simple process. We can walk you through and we provide you all the information of our practice and kind of how the whole system works. And if you need more information, you don't have to sign up right at that moment. We're happy to give you whatever information you need to help you make your decision.
Now, some of these plans, I've looked at these plans, and they may only allow up to 9 visits or 6 visits with the doctor per year. You will see them more. You'll go outside the plan. Is that right?
300 visits. Well, I mean, it's however many visits you need, because again, our success is your success, the way our model is set up. The more healthy days you have, the better we do. And if that's seeing you every day, it's seeing you every day. And sometimes people have a lot of stuff going on, either when they first join us or they've just gotten out of the hospital, and we'll see you every day, a couple times a week, whatever you need to be healthy.
And when they go there, most of the medications you're carrying there for the seniors, is that right?
Most of the basic
so they don't have to go
medications-
somewhere to a pharmacy or whatever.
Yeah, most of the basic medications that you're going to need, we'll be able to dispense right there for you.
So this is great for people that are very low income, below the poverty level, but also for people with money as well. Even with the best insurance, this is getting, with the Medicare, Advantage program.
With the Medicare Advantage
you
program,
get your own doctor, they'll pick you up if you live 8 miles away, drop you off.
And you get people that care about you and demonstrate that every time they see you, every time you call. You're not a burden, you're not a problem, you're not something that's lousing up their system. You're why they're there, and you get treated that way.
And again, we really are out of time, but it almost sounds too good to be true. Do patients feel the same way sometimes?
Sure, people come in skeptical, but I hear that all the time. I have this lady comes in and she's got her bag full of medicines and her 3 different kinds of insulin that she's taking, giving herself 4 shots a day and another shot once a week, and her blood sugar's still not controlled, right? Okay. And I saw her every couple of days and then every week, and we got rid of a lot of that stuff, and and every time she would come in and really she'd say to me, just nobody's paid this much attention to me ever before. Nobody's really cared about me this much. It's but we hear stories like that all the time.
And you look at yourself like you're the quarterback in their care.
Yeah, we use the term general manager. Okay. That's exactly what it is. We are, if you go out to a specialist, we're actively reaching out to that specialist to find out what's going on, what's happened, what's the follow-up for that, how does that integrate with everything else you're having. I this week called a patient who's in the hospital, but that's not unusual. My patients are in the hospital. I call them. Okay. I want to know how they're doing, even when they're in the hospital. And And she was actually really surprised. No doctor has ever called her when she was in the hospital. But we're not only calling the patient in the hospital, we're calling the hospitalist, the doctor taking care of you in the hospital, specialists you might go to. We want to know everything that's going on because we're there to connect the dots, right? This specialist is just looking at that part of you, and this specialist is just looking at that part of you when you're in the hospital. They want to get you well enough they can get you out of the hospital, but we're there looking at, taking care of, and actively managing with you the big picture of your health.
So final message, we're out of time. Somebody watching this, maybe they're very low income. They don't even have a ride to the center. They have questions about Medicare and a Medicare Advantage plan, and especially for those that aren't happy with their current care. And they want maybe to change primary care physicians, but they think it costs a lot of money. And they're hearing what you have to say, but for whatever reason, they're still hesitant. What do you say?
I say, give us a call and come visit us. The best way to learn about us is to get to know us. So call, we'll help set up a tour, you come in and see our center, and you can decide for yourself.
Now, a big emphasis of yours, you said that when we do this interview, you want to make sure that you get across that we really do treat our patients like family.
Absolutely. It's easy to say. A lot of people say that, we treat you like family. You see it on commercials all the time. But as an organization, as individuals that we bring into our organization, we are passionate about great care. We, as an organization, want to honor, not just meet the bare minimum needs of, but honor the seniors. And that means honoring you, honoring your spouse, honoring your mother, honoring your father with the kind of great care they deserve, the kind of care that you would want to see your family member get, the kind of care I want my family member to get. That's what we're doing there.
So if somebody's watching this and wants to get started and they take the tour that you recommend, they tour the center, how soon can they get started?
Right away. We do this every day.
Okay.
People come in, they take the tour, they, as we expect, they really like what they see. We connect them with the doctor, we get them a first appointment, we help them through the insurance process, and we get you signed up right away as a JenCare member, and they're happy they did, and we loved having them as part of our program.
Okay, good. Thanks for coming on the program. Very good.
Appreciate you inviting me. Thanks so much.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.